In San Diego County in Southern California, a parenting program is having great success, improving public health, inspiring other counties to follow suit. The Triple P Positive Parenting Program is achieving improvements across the population in child well-being and parent-child relationships.
We're a border town, so we're very close to Mexico, and we do have a lot of families who are Spanish-speaking, have been Mexican immigrants in the past or recently immigrated, and tend to be very needy in most parts of their lives and really looking for the best life for their children.
They are getting help from a very creative and thoughtful implementation of Triple P. The provider is Jewish Family Service, JFS, a nonprofit agency with a long history of serving San Diegans in need, regardless of age, race, or religious belief. Since 1918, JFS has helped refugees and immigrants all around the world.
Jewish Family Services of San Diego is doing a stellar job. They have a very small, efficient workforce. They're able to see a lot of parents in the community. So it becomes a very cost-effective approach for providing parent education to San Diego.
Part of the reason I do this work is because I see the power in it. It's really incredible what can happen in a community when you learn Triple P, and it's really because it works. It's not, it's not rocket science. It really does change families' lives.
Muchas gracias por venir aquí. Muy buenas tardes.
Job one is to get parents through the door to attend Triple P sessions. Parents who may be overwhelmed by everyday problems and dubious about a parenting course. To make it easier for these parents, JFS provides on-site childcare. It's an important benefit that lowers barriers for families to participate.
If they need food, we do bring them food. If they need transportation help, we provide that. If they need childcare, we provide childcare.
Most of them are a little skeptic at the beginning. By the second seminar, those that were willing to take the challenge to put into practice what we talk about in the first seminar, they're just amazed. They're blown away by seeing how quickly the little change that they make and how they respond to the child's behavior gets the child to change their behavior.
Y cuando mamás son tan absorbentes, they were born in another country, and even though Mexico is only 20 minutes from here, it's a different culture. So the stress is an issue, and self-control is pretty important for them in order to better raise the children, in order not to react, but to respond.
En primera,
The first lesson about how to ignore the child when it's throwing a tantrum, I've learned to control myself, not to yell and talk to the child. And until now, it's working.
porque a veces
Sometimes you think only the children need to be corrected. Here I've learned that the child is only part of the problem, but my behavior is also a part of the problem.
Ay, qué bueno.
A key strategy of Jewish Family Service is to host seminars when and where families are likely to come. To create collective impact, they work with Head Start sites, which provide early education to preschoolers from low-income families.
Just trying to get access to the parents wherever they're at. Sometimes there's classrooms available, sometimes there aren't. We've done Triple P in the park. We've done Triple P, sitting in the corridor of a school. We've done Triple P pretty much wherever we can to be able to get access to families. By doing something that helps their parents' stress, depression, anxiety, as well as their children's behavior, it really makes a difference in the family's life to be able to address the other things. So if they're doing better with their parenting and their child's behavior is better, it allows them to succeed a little bit better at work or seek the employment that they really want.
San Diego is home to a large armed services population, so Triple P is offered to military families. Today at a Marine base, it's the final one-on-one session for Lisa, who's been busy with 4 children while her husband is away on a long deployment.
One of the things I always struggled with was trying to find a good routine and just remembering that they're going to respond better if they know what to expect. And I don't get as frustrated, I don't lose my cool as much, and they don't lose their cool as much.
Awesome.
They see the difference in a week, how
using our routine every day change the behavior of the child.
Often we benefit from just sitting around and chatting with each other. Our staff here at JFS are not counselors, they're not trained clinicians, and that's a unique thing about our program staff here. We are hired for our experience, for our knowledge of the community, and for our ability to connect with parents.
To evaluate the impact on families, moms and dads are asked to assess themselves and their children and observe changes. The results are very encouraging. After participating in Group Triple P, parents reported 88% of children with social, emotional, and conduct problems were noticeably improved. Not surprisingly, when asked about their own emotional lives, 82% of parents reported significant reductions in their stress levels, symptoms of anxiety, and feelings of depression. Triple P improves families across at least 2 generations. San Diego is demonstrating that small changes lead to big improvements. Families who report the most significant challenges before Triple P tend to experience the greatest gains after Triple P.
We're very proud of the fact that over the past approximately 6 years that we've had this program here at JFS, we've served about 10,000 parents across San Diego County, and about 20,000 children have benefited via their parents participating in the program.
Triple P teaches us to think big. When you do this, when you multiply this out, when you scale it up, you can achieve some real reductions in the key child welfare indicators of a county, reducing the risk of child maltreatment, reducing the risk of out-of-home placements, improving resilience.
And that's exactly what San Diego County set out to achieve. Funding for the program is provided by the county's Health and Human Services Agency and California's Mental Health Services Act.
There are over 3 million residents in San Diego County, and our goal is to have each member in our community be safe, be healthy, and be thriving. And Triple P is one way in which our residents and our families can achieve that goal, and where they can see their families achieve good mental health and thrive.
I really believe that it will change the world, it will change our state, it will change our county. It will change the face of the child behavior problems that will eventually become, drug or alcohol problems, mood disorders, other things. All of those things roll along, and if we can work on stopping them early, that's the goal.